Dear friends, ladies and gentlemen, I am delighted indeed to be here with all of you today on the occasion of World Hypertension Day. This particular day was declared by International Society of Hypertension and World Hypertension League, 17th of May. It's a very important day because the main theme this year is know your numbers. It's very important that all of us should know what are the numbers of my upper blood pressure and what is the number of my lower blood pressure, so that we can intervene by lifestyle modification, by drug intervention, and reduce the morbidity and mortality. Ladies and gentlemen, hypertension is a silent killer you are all aware of because it does not produce any symptoms. You all know that India is the world capital of diabetes, world capital of obesity, and world capital of heart attacks, and now it's the world capital of hypertension. It's a matter of great concern. My objective today is to draw your attention and execute our attention to wellness from illness. Once we move from illness to wellness, I'm sure we'll create a healthy India. Swasth Bharat and Swasth Dil, healthy heart and healthy India is possible only by controlling the blood pressure to its normal values. It's a really very important. I call this as uncontrolled hypertension as a hidden terrorist. If it is uncontrolled, it may cause heart attack, brain attack, leg attack, abdominal attack, and an eye attack. What is left? A lot of patients fall victim to kidney problems. It is only because of uncontrolled hypertension. So I think we have to understand the concept of what the blood pressure is, what is the mechanism, what causes it, what are the risk factors, which I'll be discussing very soon in the next few minutes. If you all understand what is blood pressure is the pressure generated by the blood during the contraction of the heart and the relaxation of the heart, so that when the blood flows in the circulation, it supplies nutrition and oxygen to various organs of the body and the tissues. No blood pressure, no tissue perfusion. No blood pressure or low blood pressure, then the organs will be damaged. So we have to optimize the blood pressure. To have a perfect blood pressure, the number is 120 by 80. What's the number? 120 by 80 millimeter of mercury. And if the blood pressure rises above this, we must be concerned and try to follow all the principles of lifestyle modification so that the blood pressure is under control. Number two, how do we measure the blood pressure? It's very important because when we go to a doctor, sometimes there is an element of worry or stress and the blood pressure rises to some extent. That is known as white coat hypertension. And all these individuals who have white coat hypertension are vulnerable to become hypertensive in the future. So the best method is self-regulation or self-monitoring of the blood pressure by home blood pressure monitoring. It's a very important message on the occasion of World Hypertension Day. Everybody should monitor the blood pressure at home by home blood pressure monitoring in a digital way. We don't need mercurial, we don't need aneroid BP apparatus because you have to hear the cord cause sounds, which is very difficult at times. Here, by digital methods, you can easily evaluate the blood pressure and we can reduce the morbidity to a large extent. Second one is, if the blood pressure is too high and uncontrolled, then you must see your doctor and evaluate the blood pressure. Is it an uncontrolled hypertension or it is a resistant hypertension? We can easily see the pattern of blood pressure in 24 hours to 48 hours. And we can see normally the blood pressure at night dips by about 20 millimeter of mercury. If it does not dip, we call it a non-dipper or reverse dipper or extreme dipper, or the patient may have morning surge or evening surge or a rise or fall of a baric index, what is known as hypobaric or hyperbaric. Double product may rise and there will be diurnal variation. So overall, the load of blood pressure increases on the heart and other organs of the body, including the blood vessels, which is almost in miles. The blood pressure goes to miles of blood vessels, which is in our system, in the heart, brain, kidneys, eyes, periphery, everywhere. Next question is CBPM. CBPM is a clinical blood pressure monitoring, and HBPM is a home blood pressure monitoring, and ABPM is a 24 to 48 hours ambulatory blood pressure monitoring, and it has to be done or advised by the hypertension expert so that they can manage the patient meticulously and reduce the event rate and morbidity and mortality. Next question is, what are the factors responsible for the high blood pressure? We all should know, because there are a lot of risk factors which are within us which are responsible for increasing the blood pressure. Most important is obesity. If you have a pot belly, when the central obesity is more than 90 centimeters in men and more than 80 centimeters in women, then you are more vulnerable to high blood pressure. So please do not have pot belly. No tond. When there is a pot belly or central obesity, you are more vulnerable to get a high blood pressure. We had a huge data which we have published in the Indian Heart Journal, and we have shown 60 to 70% of these patients between the age group of 40 to 60 may get hypertension. The prevalence of hypertension is rising in our country. What's the prevalence today? It is 30 to 35% in adult population in the urban areas, and in the rural areas it is 15 to 20%. To understand in a very simple way, as the age advances, we have a tendency to rise the blood pressure. That's what we say. 50% of individual hypertension at the age of 50, 60% at the age of 60, 70% at the age of 70, 80% of the age of 80. And then if you have comorbidities, then the prognosis becomes worse. And we have to select the drugs and select the lifestyle modifications accordingly. So it's very important to understand the normal blood pressure is 120 to 80, borderline elevated when it is 120 to 129, and it is 80 to 84, and it is high if it is beyond 85, lower one, and more than 130, upper one. This is the criteria we have to follow, and most of the patients, they come to us as an emergency with a blood pressure of 200 by 110. So they are very, very important. What are the complications of high blood pressure? You all know, as I mentioned to you, it may affect the heart, it may affect the kidneys, brain, eyes, even it may dissect the arteries. It may dissect the aorta, the carotid artery, the coronary artery, and the renal artery, and may be catastrophic. So these are very important. What should be our modification? We should have a lifestyle modification. No stress. It's not possible not to have stress, but we should learn how to cope with the stress. Stress factors like fit of anger, agitation of the mind, arrogance, vengeance, vindictiveness, suppression, frustration, depression, repression are the main factors responsible. Or if a person is very, very aggressive and violent, it may produce a fit of high blood pressure and can produce a catastrophe. So no anxiety state. Our objective is all these stressors are worst factors to increase the blood pressure. Regular exercise, 30 minutes every day, 7 days a week, and preferably heart-friendly exercises like walking, jogging, swimming, dancing, cycling are the best exercises. Heart-unfriendly exercises should be avoided, like weightlifting or push-ups should be avoided. They are very, very bad and they should not be done. Control obesity, and the best way to control obesity, I have told you the variables. Abdominal obesity should not be there. Third, no smoking. Smoking may increase the blood pressure. Alcohol in limitation. If you take the higher dose of alcohol, it may increase both upper blood pressure and lower blood pressure, may cause a lot of fluctuation. Most important is diet. You should not consume salt more than 4.5 to 5 grams. Most of us take salted stuff, salted biscuits, take pickle and take vinegar or take all salted stuff, they increase the blood pressure. Indians consume more salt. So salt should be restricted. No fried food. Avoid fried food more often. That may also be responsible. And one should not take fatty meal. High cholesterol, high LDL, high triglycerides may also contribute to increase in blood pressure. We should increase the HDL, which is a very, very important parameter responsible. And we should keep on doing all the functions. Now, how to evaluate? I think after the age of 20, you should know your blood pressure. And if you are hypertensive, you must have a complete blood test, including kidney function test, liver function test, your lipid profile, thyroid test, including what we call as HSCRP, so that you know any inflammatory process there, insulin levels, and you should know your EKG, and then we also do fundus examination. And the most important thing is all the patients of hypertension should have an echocardiographic evaluation. That is a cornerstone of management of hypertension to reduce the morbidity and mortality. We see the LV function, we see the hypertrophy of the heart, we see the filling pressures in the left ventricle, we see the filling pressure in the left atrium or in the pulmonary capillary wedge pressure. We also see the stiffness of the heart by measuring the strain rate. And I think this is a very, very important parameter which should be done in every patient. Renal Doppler. And some patients who are uncontrolled despite medication, and if the requirement of medicines is more than 3 from different class of medicines, then we call this as resistant hypertension. Out of all these 3 medicines, one has to be diuretic. So when they are resistant hypertension, they have to undergo polysomnogram, a sleep study, because sleep study or sleep abnormality is very, very important to give rise to a high blood pressure. So polysomnogram will give an idea about the sleep apnea, because there are some people who snores a lot, who are more vulnerable to a high blood pressure. So this can be checked by apnea index or hyponia index. Echocardiography, renal Doppler are very, very important. We also do these days PRA as a plasma renin activity, or also see the aldosterone renin ratio, which is very important. And once we diagnose these patients with resistant hypertension, they are more vulnerable to have morbidity and mortality. They must have a drug titration and lifestyle optimization. We should know what drugs have to be taken. Diuretic is very important. The drugs which increase the urine output, especially chlorthalidone. Chlorthalidone is a metabolic friendly diuretic. Other diuretics like hydrochlorothiazide or indapamide are also there, but they have their own issues. For example, hydrochlorothiazide may cause hyperuricemia, more prone to diabetes. It's not metabolic unfriendly, and even recently some data is coming about the cancer with the hydrochlorothiazide. Other drug besides this is the beta blocker, because all the hypertensives have increased sympathetic activity, and the best beta blocker is use beta 1 sympathetic activating beta blocker is very, very important. So they are super selective. Beta 1 selective, what we call as bisoprolol is a drug of choice in young hypertensives. We can also use metoprolol, and in some patients nebivolol or carvedilol. But the drug of choice is bisoprolol, especially in resistant hypertension. Huge data to support my statement, what I am saying. Then ARBs. ARBs can be used as irbesartan is better than telmisartan or olmesartan or valsartan. And if you find they are not able to control the blood pressure with these, then you have to switch on to other drugs. These days are ARNI, or what we call as a ARB with neprilysin inhibitor. And we also use drugs like SGLT inhibitors, which are very important if a patient diabetic and hypertension. And we also use some renal denervation technique these days. There is some success with those. But this is how we know about the treatment. Once you are hypertensive and you are on medication, please take it for a long time. Proper adherence, proper compliance is the need of the hour. Don't underdose, don't overdose. And there is a seasonal variation of drug requirement and lifestyle optimization. You should go to an expert and analyze you thoroughly, and then follow up the patient, so that till the age of 80, you should not have any morbidity or mortality with the high blood pressure. Ladies and gentlemen, a very important message today is hypertension awareness is the need of the hour to reduce the catastrophe produced by uncontrolled hypertension. And the awareness can be done by organizing BP checkup camps. We must have messages through digital media in the form of Facebook, Google, Instagram, LinkedIn, and YouTube, and many methods. For example, we can take the help of organizations like governmental organizations and non-governmental organizations like Rotary, Innerwheel, FICCI, CII, PG Chamber of Commerce, SCOPE, SHM, and many other organizations can be involved. Innerwheel, they all can be involved and enhance the awareness in the schools and colleges and the corporate world. And we will make our country as a hypertension-free country. Ladies and gentlemen, whenever I go for the round in the ICCU, I find 80% of my patients are hypertensive and they have some comorbidity. Either they have a stroke, or they have a heart failure, or they have a heart attack, or they have a kidney problem. So hypertension awareness is the need of the hour. Control your blood pressure so that you come in the category of controlled blood pressure or hypertension and not uncontrolled or resistant hypertension. Thank you very much for giving attention on this occasion of World Hypertension Day. I always say, grow younger and live longer with a normal blood pressure. Control obesity. Don't have pot belly. Shorter the waistline, normal the blood pressure line. I always say, what you eat definitely matters, but what is eating you matters more. If you take care of all this, you will control your blood pressure. So I think emotional stability, adequate sleep, adequate hydration is the need of the hour, and all the precautions which I mentioned to you have a normal blood pressure. Keep your numbers to normal. That is the agenda of the World Hypertension Day. Thank you.